physical health is a key component to people's thriving, right? It's an internal strength that we all have. We talked about nutrition, people mentioned that. We know that in ASD there's a significant number of medical conditions and underdiagnosed or untreated medical conditions. I used to work at a residency in a psychiatric inpatient ward for people with intellectual disabilities and people with autism in Toronto. And there was a young man who was brought in very aggressive on antipsychotics, on a number of different medications, and through in that kind of safe environment where there could be medication management and people could take them off the medications one at a time to understand really what each one was contributing to kind of his care. They actually realized through an assessment that he was severely compacted, right, very constipated. And the side effects of the medication had a role to play in that. And by relieving that constipation, he wasn't able to tell anybody himself or point to his stomach to say that he's having pains. So his community breakdown, not all of his aggressive behavior, but part of that aggressive behavior was actually related to his very primary care kind of issue that was going on for him at the time. And after that was addressed, then they could implement other behavioral approaches as well as pharmacological approaches to support him the rest of the way. But it's a clear example of what we mean by underdiagnosed or undertreated medical conditions. Okay, in BC, so back to the BC study for a second, or the BC component of the study, we asked people about their health service use in the last year, the last 12 months. So from primary care, how much did people use or what did they do? Flu shot, physical exam, family doctor or pediatrician, going to a dentist, at least one specialist, or being hospitalized overnight, right? So these are the rates, just as a little information. In terms of caregivers of the preschoolers, about 35% at the time in this 2014 year said that their child had a flu shot in the last 12 months. You can see that about 80% had a physical exam, almost 90% went to their doctor in the last, or their family physician in the last 12 months. In terms of the numbers who went to dentist, I mean, that's, this is preschoolers. In terms of a specialist, over half used at least one specialist in the last 2 months, and very few had been hospitalized. In terms of school-age youth, we see a similar profile over time, with higher rates going to the dentist, which I think makes a lot of sense given the age, and lower rates around getting a flu shot, lower rates of having a physical exam, and slightly higher rates of hospitalization, but still very low. And we see a similar profile again around caregivers of adults reporting on access, with even lower rates of having the flu shot, lower rates of a physical exam, and similar rates of dentistry and specialization, and slightly higher rates again of hospitalization. And of that very small group of self-advocates, we see here what they reported in terms of their use. So across different age groups or different groups, very similar profile overall, except for perhaps hospitalization for that very small sample of self-advocates, right? I'm not going to say anything else other than I want to share that information with you. I thought it would be useful or interesting. In terms of access to physical health for ASD, So thriving, it's not just about talking about Temple Grandin, right? These are all instances, and none of them on their own is part of it, but we're starting to see a story here develop of some things that are related in the research and some things that people are saying. And maybe even an emotional experience. When I see her talk, there's a connection that I have with what she's saying and how she's saying it. Pleasure. It's important to me what she says, and I can see how meaningful it is what she's doing. Right? The last thing I'll say before we break is about the emotional skills. We're very interested at York and elsewhere on this idea of mindfulness-based stress reduction and mindfulness-based cognitive therapy as a way of building emotional skills, not waiting for problems to develop in the first place and then putting it in place to reduce symptoms, but actually creating this, just like in physical health. For physical health, that's not something that we wait until somebody becomes very overweight and then they should start to go to the gym, right? This is about activity at the beginning and for forever. It's about an ongoing process of staying healthy, exercising physically, and we're very interested in mindfulness as a way of exercising the mind for your mental and emotional health. And there's a lot of evidence around this idea, trends diagnostically. It's not just about autism at all. There was one RCT with adults with ASD that has shown considerable effects at reducing negative experiences of depression and anxiety and rumination, and a number of single subject designs that have shown that we could not only address problem behaviors, but boost social skills, behaviorally based social skills through mindful parenting. So what they actually did was they didn't even, in that study, work with the child with ASD or intellectual disability. They provided mindfulness training to the parents, and they didn't even tell the parents, this is what you should do with your child. All they did was help the parents with their own mindfulness. And then they went and they observed and they got information on the kids over time and saw indirect changes over time in the children's behavior. Now, it's one study and there's plenty of other research that can do, but the point is that there's something here around this emotional and meditative kind of exercises. Souls of the Feet is an example of that that's been used with young people with Asperger's syndrome, young people with intellectual disability, young people with autism. So this is a set of techniques, just like ABA, that can be used and tailored to the unique cognitive and developmental levels of people who are using it. It's not a one-size-fits-all. We have a project now going on where we're doing a mindfulness-based training with teens with ASD and their parents, where they come into, and they don't need to have significant behavior problems to begin with to come in, but many do. They come in and they both learn mindfulness separately. It's called My Mind. I'll show you a clip of it now. I figure you're sick of hearing me talk. So it's never perfect, but the idea of mindfulness there and sensation, it's not about getting him into this Zen state where he's transcending his experience and sitting perfectly still. It's a young man, an 8-year-old boy who's able to lie there and get something out of doing this process with his therapist in a way that is very easy, it's quick, and we can practice it again and again.